For my dietetics placements, they get broken up into three main areas. So you look at individual case management, which is the area that I'm in now. You also do community health and public health nutrition, which is a different section of dietetics that you can move into, and also food service dietetics as well. For my individual case management, I did my first 6-week placement at Caboolture Hospital, and then from there I moved up to Rocky for a 5-week period and did a placement at a community clinic, which was again a Queensland Health site, and it was very similar, I guess, to the type of work that I'm doing now, as opposed to working in the hospital environment. There is a big difference between seeing people out in the community as opposed to seeing people in hospital. I also did my food service placement at the Royal Brisbane and Women's Hospital, which was a 4-week placement, and I did my community and public health nutrition placement at Anala for 6 weeks towards the end of the year as well. And they were all very different placement sites, and I was able to learn very different skills at all the different sites. Very different when you're looking at working in the hospital as a dietitian versus working in private practice. Probably the main difference is the reason that you're seeing clients. So the majority of people that you see in hospital, you're seeing them because they are undernourished, and your role is to provide adequate nutrition to them for their period of time that they're in hospital. As opposed to working in private practice, you're quite often seeing people with chronic diseases. So there's the big difference in terms of the dietary advice that you're providing people, first of all, but also major differences in how your day of work pans out. So in the hospital, obviously the patients are in their beds, so you can go to them whenever you need to. They don't not turn up to an appointment, they're stuck in the bed, so they're always going to be there. Whereas in private practice, you can get people not turn up to appointments, cancel late on you, all that sort of thing. In the hospital, however, you can sometimes get frustrated because you spend a lot of your time running around chasing up medical charts, or when you finally are ready to see the patient's off getting a scan somewhere. So it can be a lot of time when you're actually not spending time with patients because you're running around trying to organise to see the patient, basically, which can take up a lot of your time.